devil is already keying in.
I said, yeah.
Yeah, with that, you will not go and hold that nonsense and end up being a victim of what otherwise he would have been in position to subscribe to and be able to live. So it's something that is subject to the discretion of your doctor.
All right then. Oku, this is from. Sorry, I think I saw this here. She was talking about she's in her period from the 19th of May. Don't know where that message has gone. She saw it last since the 19th of May. She said she's gone for scan. She's not pregnant. That what could be the problem? Since 19th of May.
Depending on the age of the fellow, it may have what is called polycystic ovarian problem. Depending on the age, it could be because of pre-ovarian failure, premature ovarian failure. It could also come from menopause. So a lot of factors. So the person needs to get to the hospital and properly evaluated.
All right then. Okay, yes, that says, good morning, sir. Please, I saw my period last on the 19th of May. Up till now, I've not seen, and the pregnancy test shows negative. What shall I do? This is Okuchi and Anaba Onwachuku. All right.
That's what I said. Yeah. Age, and the hormonal factors and all that. And if there is any abortion done for which there is a gumming together of the two surfaces of the womb, you call Asherman syndrome, amenorrhea traumatica, or ultrasonic, as any of the doctors may use. Such could be in position to cause.
Please, doctor, I've had 3 CSs, I think, and I lost 2, but the 3rd one is alive. I have 3 C's. I don't know what that means. I lost 2 and the 3rd one is alive. Doctor, please, I want to have another baby, but I keep having miscarriages. I want to know what to do, please. Remember we mentioned miscarriages at the 3rd and 4th trimester. We did say we'll come back to that.
Is it 3rd and 4th? I said first trimester.
The 3rd and 4th month in the 2nd trimester. Yes. Yeah. So during the 3rd and 5th month in the 2nd trimester, what could be causing that? You mentioned that. So what can one do if they're experiencing that?
If they're having a recurring miscarriage secondary to cervical incompetence,
yes,
the person should have what is called cervical sacrilege. When the woman gets pregnant, about 13 weeks to 14 weeks, you tie the mouth of that womb strong. So when that is done, and the course of delivery, you can untie it and the woman can.
Okay. All right. Good morning, Dr. Koi. God bless you for all you're doing and your humility. It's out of this world. Doctor, please take a day and talk extensively on staphylococcus, because this has caused so many family problems and kept people in years of bondage. Please shine your light of knowledge on it. Thanks. Uday, he's sending this from Dubai. But I think we've spoken about staphylococcus before. Lolo from Bakana says, good morning, doctor and Annie. Thanks for the expository. But my question is, why are some children unable to talk clearly, even at the age of 5 and 6 years?
Actually, when it has to do, in as much as there is no obvious developmental milestone problem with that very baby, you will not be in position to... there are people that naturally just take their time. They are not the type that
don't rush them along.
Yes, so you don't know what God will call the person for.
Good morning, doctor. Please, can I have vaginal delivery with Bartholin vaginal cyst?
Bartholin cyst is a different issue, but obviously, why not be in position to have it removed? But it's something that the delivery is, when the delivery is a function of the cervix opening up fully, baby will come out. Whatever it is outside, say majora kind of problem. Yes, it's an infection of that very vaginal cyst. Yeah. So you get the vagina looking big. Okay,
but you said it can be removed.
Yes, it can be done. You can do marsupialization for that. But it's something that a baby can come out.
Good morning, Annie and DrSaveAlife. My questions are, it's my first pregnancy, sir. My last period was in April 2021. Please, when can I register for antenatal and scan, since I have been confirmed pregnant through blood tests?
Yeah, go to the hospital of your choice and do that.
All right. Secondly, I'm an ulcer patient and it's not been easy with me. How do I handle this?
Ulcer?
Yes. So she's an ulcer patient and it has not been easy with her.
Maybe is it with pregnancy?
I don't know whether it's with the pregnancy. She didn't indicate.
Yeah, it just pregnancy-induced
ulcer.
ulcer. Yeah, it's one of the stress ulcers. But I've already said here that when you have anything that has to do with chest pain, don't think of ulcer first. Go for your heart.
Eliminate that first.
Be sure that your heart is not causing problem, because that is the one that kills.
And she says, ABA says, lastly, I am AA genotype. My husband, same. Our blood group, I am B positive, and he's O positive. Hope we're okay, sir.
Yes, you are.
This here says, good morning, Annie and the doc. Please, I want to know what causes blood spotting in pregnancy, which requires bed rest, and it stops after a while. It occurred in 3 pregnancies. Mrs. Life.
It all depends on the location. The commonest cause of such is what is called initially, but the first trimester, when the not first trimester only, when the implantation, you can have implantation bleeding. That's a different problem. But you can also have what is called placenta previa. If the location of the placenta is on the lower side of the cervix, intermittently, that such bleeding can occur, and that's one of the things they said you have to be in position to observe, and then take it off from there.
Okay. This is from Kenneth Okori. Says, good morning, doctor. Please, can a couple decide on the status of pregnancy, male or female?
The status of the pregnancy, that is to sex, the sex of the baby.
Yes, the sex of the baby.
Yeah, there's a lot of theories, regarding that, but apparently it's not something I can state here as a guaranteed factor. Being in position to monitor the ovulation vis-a-vis the intercourse that can give right to male or female. It's not a very it's not a stamp on the rock kind of decision, because most times it can fail also.
All right then. Einaya Phoebe Fakule says, good morning, doctor. What precautions should a woman above 46 take to ensure she has a normal baby and she's okay during delivery and during pregnancy and after delivery?
As the first and first is to go for pre-pregnancy counseling. It's not something we will be here to, because such women should go for pre-pregnancy counseling. And based on that, she should just you get pregnant prepared. You meet the challenges associated with the pregnancy already prepared. Do you understand what I'm saying? It goes a long way to safeguard whatever be the consequences. But in a situation where you don't know, everything comes to you as a surprise, most times it's usually been